74-year-old male. In March 2015, surgery for lung adenocarcinoma. 5 months later, balance and gait disturbances. 7 months later, loss of left peripheral visual field. And 8 months later, dizziness. This is his preoperative MRI with axial cut, sagittal, and coronal cuts. It shows a contrast-enhancing lesion over the right paraccipital region. Here on the sagittal cut, we can see that the lesion is actually located at the cuneus and is in intimate relation to the lower lip of the paraccipital sulcus. So we can see here the lesion located at the cuneus related to the inferior portion of the paraccipital sulcus. And then this is a coronal view of the lesion. Since this lesion is related to the paraccipital sulcus, so why don't we use this paraccipital sulcus to approach this lesion? And this lesion is very suggestive of metastasis. So in December 2015, he underwent a right paraccipital sulcus approach. So the patient is in the lateral decubitus, and his face is facing this way, and the occipital lobe is on my left. This is superior sagittal sinus. So the parietal lobe is over here, so the right hemisphere is down. So I'm hoping that the gravity will help us to gain space through the inner hemispheric fissure. Let's go to the video. So we're trying to dissect inner hemispheric fissure. The brain is kind of swollen. So trying to cut the arachnoid to access the inner hemispheric fissure. And then additional stitch is necessary over this area. So we dissect, try to preserve those veins draining towards the superior sagittal sinus. An additional stitch is necessary to make more retraction and give me the more room. And then I place gel foam here, gel foam there to keep the space open. And then I will dissect the paraccipital sulcus. This is a very deep sulcus. So on the right side of the sulcus is going to be precuneus over here. On the left will be the cuneus. So keep going, opening, and soon I can see something here. You can see the metastasis is over here, the yellowish tissue, tumor. So just now I'm exposing more of this tumor. It's a soft, not so bleed. It doesn't bleed that much, very soft. So I'm getting samples for the histology analysis of the tumor and emptying the center of the tumor, and then gradually I was trying to work around the center of the lesion and getting samples of the tumor. And this is the beginning to see normal white matter and working around the tumor. So here is when I am starting to see normal white matter, still tumor to be removed. Now this is ultrasonic aspirator, and then Still tumor over here. Trying to pull this tumor out, but it will come in pieces. Anyway, this is cottonoid. And now this is tumor. Still more remaining tumor to be removed. This is okay. Now checking the hemostasis. See the normal white matter, and this is normal gray matter, and finally apparently there's no tumor left. See, this is normal white matter. This is his postoperative CT scan soon after the surgery, apparently with the total removal of the tumor through the parieto-occipital sulcus approach. And soon after the surgery, he was neurologically unchanged.